Can we reverse engineer menopause education? I believe we can. Here's why. I got the best DM this week from a patient, and I'm sharing this story with permission. This goes back many years, and I've often told this story when I give talks. So I had a patient years ago who came to me in family practice, and she sat down and she said, listen, I've been doing my homework. I made sure there are no contraindications for me to use this, but I am really struggling with my menopause symptoms, and I would like to have a 3-month trial of Duaviv. That's what she chose as what she felt would be the best fit for her. Now, she said, I understand, you might believe this is risky, but I'm willing to take the risk, and let's meet again in 3 months and sit back down and decide whether it's working, whether it's worth continuing. But what that actually did for me, even as I handed her that prescription and I was terrified and I was totally convinced I was giving her basically a ticket for breast cancer, was it forced me to go and take a look at the evidence around Duaviv and to reassure myself that, oh, hey, wait, this actually looks pretty safe, and maybe I should start exploring this a little bit. Maybe I'd be comfortable prescribing this to some patients. And I can't say that overnight it just opened my eyes and undid all of the broken telephone type training that I'd received in school, which is putting it generously. But it did, I think, open that door just a little crack. And so I think that by being open to allowing her that autonomy to make that decision for herself, and her being so direct and bold in putting it that way to me, really helped. And so don't be afraid to use that type of a script with your own provider.